Yourself, go.
So I'm going to be helping Sophia and Raf narrate based on their lung transplant questions for a good friend of mine, Anna Dress, who got a double lungs transplant at the beginning of last year. I was with her from time to time, so I got to see a lot of her journey a little bit, but this is her answers to the questions that they had.
All right, so first question would be, what disease or condition do you have that caused you to have a double lung transplant?
She had pulmonary fibrosis, which was secondary to scleroderma, which is a restrictive autoimmune disease, which we'll get into a little bit.
All right, and then what symptoms did you notice leading up to being diagnosed?
At first, her hands were turning bluish black, so it seems like a cyanosis. The whole hand, it looked terrible, like a dead person's hand. Then I started getting out of breath while exercising. I thought I had asthma, so when I went to the allergist, she sent me to a pulmonologist. He discovered I had pulmonary fibrosis, and then other doctors found that I had an autoimmune disease called scleroderma, which causes your connective tissues to harden. I had systemic scleroderma that affects your organs as well. My lungs were hardening over time, and then the lungs had trouble expanding.
How has your daily life been affected having a double lung transplant? For example, did you feel any shortness of breath after certain activities of daily living, or any trouble catching your breath?
Oh my, she said. After my lung transplant, everything was the opposite of what you just asked. Those were the problems prior to my transplant. After the transplant and having new lungs, I was able to walk, talk, do daily chores and activities without getting out of breath. Life became quote unquote normal for me. I felt like a new person. Previously, I was dependent on oxygen all day long, and now I'm no longer dependent on home oxygen.
And then what do you currently do for maintenance of your condition?
Her maintenance right now consists of taking anti-rejection medicine for the lung transplant, which she takes daily. She maintains a good exercise regimen, just walking more than normal. She used to get out of breath rather quickly, and now she has a lot more time to do things, and she drinks a lot of water. She did spirometry for the first few months and the nebulizer for about a month.
Have you had any recent hospitalizations after receiving the double lung transplant?
She's had no complications of any sort, so no to the hospital. She just has periodic check-ins with her doctor.
All right, and then what was the process like to even become eligible to receive a double lung transplant? Were you quickly put on the list as a recipient? And how long did it take before you actually were selected for the procedure?
So the process to become eligible for a lung transplant candidate was a series of tests that she took that lasted about 6 months. The tests involved were CTs, x-rays, pulmonary function tests, 6-minute walk tests, and an echocardiogram. She didn't recall everything, but there may have been more tests. Those are the main tests that she took to get qualified. Once I was accepted to be a candidate for the transplant, it took me approximately 3.5 years on the list before I got the right lungs. At one time, I got called for the lungs and went all the way down to get the procedure done, and then had canceled the procedure because the lungs were not a match. In the meantime, I repeated the above test on a 6-month basis. Then it went down to every 4 months, then every 3 months, and so on.
Before getting a lung transplant, was there a lot of preparatory work that you had to do leading up to the surgery? Any special diet or specific exercise routine?
About a year before her transplant, they had her start pulmonary rehab before the transplant. It was important to keep my heart and lungs moving as much as possible and to keep myself in the best shape possible. The better shape a patient is in, the better chance of having a successful recovery from the transplant.
How do you feel now versus when you first got your lung transplant? For example, do you think your lungs felt healthier after you had the transplant sometime afterwards, or do they currently feel the best they've ever felt?
Right after the surgery, my lungs felt weaker than they do now, which I think was expected after the surgery. Some of the things that had to happen was the lungs were too big for my cavity, so they had to shave the lungs down to fit inside of my chest. But they were normally normal functioning lungs. It was an amazing feeling. I even discovered I could do the Tarzan yell in my hospital room.
Could you demonstrate that?
She was constantly going, ah, just because her voice became stronger, because she wasn't constantly out of breath any longer. And so she said they feel a little bit better now, but the lungs always felt great.
All right, and then as a future respiratory therapist, there's so much more for us to all learn. Is there anything you'd like to tell us about or teach us from everything you've gone through?
I believe I was like any other patient you may have. Well, actually, I suppose I don't know what other patients are like and what their needs are. I know my respiratory therapists were great, every single one of them. They were always positive, and they were like cheerleaders to me. I was also a positive patient with minimal problems. So I would always say, be positive to your patients, have a happy attitude and a good sense of humor. Get to know your patients. My RTs were really great to me.
And then based off of you just being her friend, what are some things that you've noticed after her lung transplant, just as a friend?
Like as she stated, she's a lot more active now. So like she said, like chores, like daily activities around the house. She used to walk around the house with a 30-foot long oxygen cord. And, that was a trip hazard. Honestly, she's a little bit older. So now like those things aren't in the way. She's just way more active. She's like able to do things on her own. Before her daughter would, drive her places just to make sure. But now she's like fully just self-reliant for the most part. And just trying to think of anything else. I just noticed that she doesn't get out of breath. If she had to talk more than 2 sentences, there was times where she'd be like out of breath, and she would like tell you like, I can't talk anymore, until she could catch her breath. And now I haven't actually seen any of that, and she's not dependent on the oxygen. So I think that's just like a big step for her. She still suffers from scleroderma, so the lung transplant didn't fix that completely. So I think over time it's going to affect her lungs again, possibly. But otherwise, I think she's doing really well right now.
How long before her transplant did you know her?
I've known her since I was in high school, but a lot closer probably over the last like 8 years. So I have seen a lot of her struggles and stuff like that. Other things that she deals with, I know that like scleroderma, it restricts everything. So she has like esophageal problems because it squeezes. So she has to go get her esophagus stretched out so that she can help maintain like a more patent airway and things like that. But yeah, she's doing really well.
All right, thank you so much.